Good evening. My name is Olivia. I'm known as Olivia K on Facebook, Ollie K on Instagram, and Warm Yam 9800 on Reddit. So on this page, I cover nursing and NCLEX related materials to help out nursing students, whether it's their first or many of their NCLEX attempts, and also to help students navigate through nursing school, as nursing is dang difficult and it can be hard. I also have reality TV or content or documentary content or movies as a way to decompress and just wind down as a distraction for nursing because it could be a lot. So I do have a playlist for high yield content regarding pharmacology. So this video will be the last. I'm going to be covering IV fluids because I feel like it's very important. So there's a whole playlist if you want to check it out. And also I have a playlist for the reality TV stuff like Love is Blind series, and I'm going to be covering Temptation Island season 2. I recovered season 1, so that's also on my page as well. Okay, so let's get started. So with IV, it is highly tested in Q banks because sometimes they may occur on the NCLEX. You might actually even see it on the ATIs. Very important to understand the type of IV fluids a patient should have because it depends on the patient's ailments and disease processes. Because of that, there are certain IV fluids that are not safe for a patient to have or a nurse to administer. So, which is why it's important that I'm covering this. In order to understand IV fluids, you need to have that basic biology knowledge of isotonic, hypotonic, and hypertonic. Because of that way you can understand the physiology and why it's important for, again, as I just said, patients to have certain types of fluids. Okay, so I'm going to start with isotonic. As you recall from biology class or A&P, these solutions have the same concentration as the cell, and so that means nothing's going to be moving in and out. There's no big or small concentration either inside or out of the cell. Then hypotonic, there's less concentration outside of the cell. So that means the water is going to move into where there'll be bigger concentration. So when the water goes right in, the cell's going to get big, right? Because all the water, all the fluids rushing in. So the way I like to remember hypotonic solutions, think of the word hypo, tomato, right? And hippos are huge, they're massive, they're big, they swell. So that's basically what the hypotonic solution will do to the cell. It's going to make it swell, get big. And then with hypertonic, there's more concentration. So it's opposite of the hypo, right? So there's more concentration right outside of the cell. So a memory trick I also like to use here, like think of a hyperactive child, right? They're so hyper, they're at some sort of environment that's going to make them really like hyper and happy, and it's a lot. So the mom's going to come drag the child outside out of the environment that's triggering the child to be hyper, and she's pulling him in to calm down. So that's how I like to think of it. I hope that helps you, because that's helped me, because I was not good at this kind of stuff. Okay, I wasn't good at this. So basically the fluid pulls out of the cell, making the cell to become small and shrink. Okay, so I'm going to go over to solutions now. So we have isotonic solutions. There's one fluid that you'll commonly recognize, so that's your normal saline. Okay, then you have lactate ringers. So those are examples. They are used for dehydration, dehydration, I just said that, hypovolemia, shock, and hemorrhage. Lactate ringers are specifically used with burn patients. Why, do you ask? Because what people don't realize is that lactate ringers, mostly the composition resembles the human blood plasma, and which will make it safer than normal saline. So I hope that makes sense. You want to monitor for fluid overload. So the signs of fluid overload would be increased swelling, crackled lungs, or jugular vein distension. So you'll see like a huge like veiny thing popping, and then it's a lot shortness of breath, etc. With renal patients, again, kidneys, hepatic patients, liver, you want to be careful with these sorts of patients when they're receiving normal saline. With hepatic patients, they may get, again, lactate ringer. And also another thing is that it's going to prevent acidosis, which we don't want for the body. And with neonates, because they're so tiny, they're so small, and their body is like maturing every second. And, well, it's immature, but because they're growing, getting used to the world, you want to use normal or lactate ringers with caution, because they do have increased risk for hypernatremia, which we don't want in the baby either. So important to know. Okay, then we have hypotonic solutions. So here are your examples. So that's 0.45% sodium chloride, 0.33% sodium chloride, then D5W. So this is used for cellular dehydration, or in some cases cellular rehydration. I need you to star and underline or triple line this. Don't use this with patients that have increased ICP, so intracranial pressure, or head injuries, because as we discussed with hypotonic fluids, when there's less concentration outside of the cell, it's going to go right into the cell and make it big. So in this case, we don't want the brain to swell, because that's what could happen. And with that said, when you're giving these kind of fluids, you want to monitor and look out for confusion or decreased level of consciousness. So definitely do your neuros when you're dealing with these kind of patients, and that's going to be mostly your answers when you're seeing these on ATI or the NCLEX or even your QBanks. Then lastly, we have hypertonic solutions. So here are your examples: 3% sodium chloride, 5% sodium chloride, D5NS, and D10W. So this is used for severe hyponatremia. So side note, natremia, because I keep mentioning this, and I'm sure you know your labs, and I'm going to do a short on labs. That means low, so hyponatremia in this case would be low levels of sodium. Hypernatremia is high levels of sodium. So in this case, you want to give the hypertonic, again, because where there is too much fluid, you want to pull it out of the cells, and it'll be needed for this case. So you want to give it for patients with cerebral edema as well, increased cranial pressure. You need to monitor, again, as I just mentioned, monitor for confusion, LOC. So hopefully that helps you. I'll leave some links of sources that can help, or videos, which I always do in every single my video. This will be the last I'm going to do for high yield pharmacology. My plan will be to do ABG tomorrow morning, and likely also do cardiac arrhythmias, because I know I got a bunch of those on my NCLEX. And thank goodness, I was able to get those. I think I got those questions right. Well, obviously, I just passed my NCLEX. And ABGs, I know a lot of people have issues with those. I'm not going to go over the the TICTO method. You know what I'm talking about. I'm not going to go over that, or compensated or uncompensated. I'm just going to go over the facts of what they are, and hopefully I can help you out the way I found it easy to learn. So I will also do those as well, and I will try to get Temptation Island sometime this weekend because I am off this weekend. Well, it was a pleasure going over IV fluids with you. Let me know if there's more content you would like to see or want me to go over nursing wise. Um, Thanks very much. And I'm so sorry for messing up with that last video. Well, you have a good night and take care. Bye.